In today's video, we are going to be talking about metformin, what it is, how it works, possible side effects, and how to reduce these side effects. If you've clicked on this video, it's probably because you've been diagnosed with prediabetes, type 2 diabetes, polycystic ovary syndrome or PCOS, and have been prescribed metformin or under its brand name, glucophage. Metformin is the first-line drug that is prescribed to patients with type 2 diabetes when diet and exercise alone has not been enough to control their blood sugar. Hey guys, welcome back to my channel. If you're new here, my name is Lucy. I'm a pharmacist and a nurse, and I post health-related videos. So let's get started. First, a brief background about metformin. Metformin, also known as glucophage, it's an oral prescription drug that lowers blood sugar in multiple different ways. By reducing the amount of sugar that your liver releases in the bloodstream, reduce the amount of sugar that you absorb in your intestines. It also improves how your body responds to your natural insulin supply. For women with PCOS, metformin can be effective because the symptoms that define PCOS, such as irregular period, infertility, weight gain, ovarian cysts, and high testosterone, are all caused by insulin resistance. So, when you take metformin for PCOS, it helps stimulate ovulation and regulate menstruation, increasing chances of pregnancy. Also, metformin can be used for weight loss, especially in women with PCOS and patients on antidepressants. Metformin comes in different dosages, normally 500 mg and 850 mg tablet. Now, we'll talk about the side effects. We are going to start with less severe but common side effects of metformin. And then we will go into more serious but rare side effects. The common side effects of metformin involve gastric discomfort, such as diarrhea. This is the most common side effect of metformin and the reason why most people stop taking it. Roughly, a third of people will have diarrhea from metformin. We also have nausea and vomiting, gas and bloating. This normally occurs with diarrhea. Lack of appetite, heartburn, and stomach pain. So a lot of people complain of these stomach side effects when they start metformin. These side effects are normally mild and usually gets better in a few days or couple weeks. But just be aware that these gastric symptoms can happen in a dose-dependent manner. For instance, you're started with 500 mg daily. You get diarrhea, nausea, and vomiting. Then after a few days, the side effects goes away. Then your doctor increases the metformin to 1000 mg per day. You may experience these side effects again. Then it will go away until the therapeutic dose is reached. Apart from the stomach issues, metformin can also cause a headache. Speak to your doctor if these side effects become troublesome. Now we'll talk about the serious side effects of metformin. These serious side effects are possible but rare. They include lactic acidosis. This is actually a black box warning with metformin. Lactic acidosis occurs from buildup of metformin in your body, which causes your blood to become very acidic. The symptoms can include trouble breathing, extreme tiredness and weakness, dizziness, fast or slow heart rate, skin rash, and muscle pain. Lactic acidosis is a medical emergency and you need to see a doctor immediately. You are at increased risk of lactic acidosis if you have liver disease, kidney disease, congestive heart failure, if you drink too much alcohol, and if you're over 65 years old. The second serious but rare side effect of metformin is vitamin B12 deficiency. Metformin may reduce the absorption of vitamin B12 in the small intestines. The risk of B12 deficiency increases with longer treatment and higher doses. When you are low on vitamin B12, you may experience extreme tiredness, pale or yellow skin, vision loss, numbness, and tingling. Vitamin B12 is essential to our nerve fibers because it helps protect the myelin sheath, a protective coating that surrounds the nerve fibers. My tip is to get your vitamin B12 checked annually, and if deficiency is found, vitamin B12 injection or supplements can help. I've had patients ask about hypoglycemia or low blood sugar with metformin. And my answer is that metformin does not usually cause low blood sugars unless you've skipped a meal after taking metformin, or have done strenuous exercise, have drunk too much alcohol, or have taken other blood sugar lowering medication such as insulin or Ozempic. Now, let's talk about how to reduce these side effects. First, start the dose low and increase it slowly. Start with the lowest dose usually 500 milligrams once a day, which is usually taken with the biggest meal of the day. It can be taken in the morning if you prefer. Then after a week or two, you can increase the dose to 500 milligrams twice a day. If you need a higher dose, your doctor will keep increasing this by 1 tablet every 1 to 2 weeks until you reach your maximum dose, which is usually 1,000 milligrams 3 times a day. The second tip is if you're experiencing diarrhea, take metformin about 15 minutes after eating food and make sure you're drinking plenty of water to replace the lost fluid. Taking metformin after a meal helps reduce diarrhea. If the first and second tip does not help, ask your doctor if you can take the extended release form of metformin. The extended release formulation can be gentle to your stomach, and it's better tolerated because it's released over several hours. Just keep in mind that the extended release tablet cannot be crushed or split, and the dose might be different. If you like this video, give it a thumbs up and feel free to share. Please leave a comment in the comment section below to tell me what you enjoyed about the video or what topics you would like to learn more about. Thanks for stopping by. Until next time, stay healthy and remember, health is the greatest wealth.